Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a very exciting guest today. This is Maddie McCain. She is a physical therapy student at the University of Miami, and I'm going to let her introduce herself. But before, thanks, Maddie, for doing this with me. I really appreciate it.
Of course, I'm excited. Like she said, I'm Maddie McCain. I'm a third year DPT student at the University of Miami, born and raised in Florida, and very excited to be here in this oncology rotation.
Great. Do you want to tell the audience a little bit about what did you do undergrad?
Yes, so I went to undergrad at the University of Florida, and I studied applied physiology and kinesiology, which goes very well into physical therapy, especially things like strength and conditioning, exercise testing, and just rehabilitation through exercise.
Excellent. So, what inspired you to pursue physical therapy, and how did you become interested in oncology specifically?
My mom is a physical therapist. She worked in the acute care setting for years, and then she gave up her career to raise me and my sisters as a stay-at-home mom. And she always talked about how much of a blessing it was to serve others and how great of a career it was as a young mom, especially with three young daughters. And then I just come from a long line of family that serves others, physicians, teachers, and that has been such a big blessing and a very important pillar to who I am. So seeing my mom go through that and love that career, I was really inspired. And then I have also a long family history of different oncology, you know, leukemia, lymphoma, that sort of stuff, and seeing how much that affected like my loved ones. I really wanted to be a better caretaker for anyone going through cancer. And my dad was a pediatrician, and seeing how much he cared for sick kids, it all kind of just inspired me to, go through not only physical therapy, but the oncology route.
Great. And how did you land in this internship? And you already kind of explained what drew you into this setting,
Mhm.
but how did you find us?
So my school luckily offered a rotation through here, and we do like a lottery system at the University of Miami. And I knew I didn't want to do just general ortho outpatient. That wasn't my calling necessarily. And we were the first cohort to get an oncology specialty class, actually. And while I got a touch of it, I wanted more. So I just put it in my lottery, and I was lucky enough to get it.
And we are so lucky to have you. What kind of cancer patients do you typically work with? Breast, head and neck,
Mhm.
hematology?
So in this clinical, it's been mostly, I would say 75% breast, 25% head and neck for in my experience. I know that can kind of ebb and flow a little bit. And then prior clinicals, I was in acute care pediatrics before this, and I saw a lot of hematologic.
So based on that, and this is week number 5, right?
5 or 6.
5 or 6, yeah, since you've been here. Um, what has been impacting you the most? What type of patients? And I know it goes per patient, not necessarily per diagnose,
Yeah.
but if we're gonna be putting it per diagnose, what have you been enjoying the most?
Um, I think I've really enjoyed the breast patients. It challenges me mentally in terms of seeing the patient as a whole and deciding what we can do for that patient. So whether that be hands-on, exercise, education, referrals elsewhere, every single patient has shown up in a different headspace with different social support at a different part of their journey. And I have really enjoyed getting to know these patients and seeing how we can fit into their life for this moment.
And that got me into the next question, more specific. So if you look the difference between a physical therapy in an orthopedic setting versus an oncology
Mhm.
setting, how can you explain to the new students who maybe are looking into doing oncology internships, what will be kind of like the general or the bigger difference that you notice one versus the other?
I would say that with my experience with ortho is it is one scope in a way where you're focusing on the low back pain, you're focusing on, you know, getting this range of motion back or this strength back. And what I have really enjoyed about oncology is that it kind of ebbs and flows. Every treatment's a little bit different. Yes, you are trying to get the range back, the strength back, whatever they're lacking, but I have seen a lot more function specific, I guess. And it's been really cool. Like I have kind of begun telling patients like our goals are your goals. So instead of really thinking about, oh, we need to get your range back, we need to get your strength back, you need to be able to do this weight or this, like it's nice to ask, oh, have you been able to go back to gardening? Are you able to, wash your hair again? Like depending on what it is, I think we have a little bit of a bigger scope, or we're looking at a bigger picture than maybe with just a general ortho.
Okay, very well said. And what skills have you found most important when working with oncology patients, clinical or not clinical or interpersonal?
This one's a hard one because I feel like both are so important, and I have been challenged a lot in both ways, which has been that's kind of the goal I had for this clinical is I wanted to take it as such a good educational opportunity. And I feel like the clinical excellence that is brought to the table is so emphasized here, especially because these patients, we do so much patient education. And I've had multiple patients be like, no one prepared me for this. No one told me this. Sometimes we're the first one bringing thoughts to these patients' heads, whether they should be concerned or not, or
Mhm.
patients bring a lot of questions
Mhm.
to us, and we are privileged enough to spend enough time with these patients to really get to know them, and so that they trust us and that we get to spend this time educating them. So that has
Mhm.
been really impactful. That it's kind of both, I guess, with the interpersonal of getting that trust, but also like we have to be up to date on clinically what the research shows, what the
Mhm.
evidence shows, tell patients you're likely to experience XYZ or you're not. And like I said, every single patient is so different. So whether they're taking a certain drug or not might change how we expect them to respond. So it's been great to be challenged both interpersonally and clinically, and you can't have one without the other here.
Yes, very good. And actually, I had somebody today actually mention, Ampulas, I'll pull you outside. And I thought um, I wanted to be in there because I thought we were going to discuss something about a patient, no, because I wanted to go after you for anything else. And he actually brought a great thing. And I just want to highlight that, which is like, how impressed he was. And no, he's an occupational therapist that is one of my colleagues who I respect a lot and does a lot of mental health here in the clinic with oncological patients. And he actually mentioned it, how impressed he's been with your interpersonal skills and the way that you communicate with patients, and you really genuinely care for them, which is really good. And I think we talk about that on your midterm. So don't ever let that go away, no matter what comes across your life and no matter the frustrations. Or sometimes, we have great patients, but sometimes we don't. And it's not that we have bad patients, it's just no their best time, I call it. And they're just really with a lot of things going on, and everybody manage those issues differently. Some better than others, and sometimes we just catch them in the wrong times. And when that happens, they just really not the greatest in the way that they say things, and the way they come across. Not that is their intention, I hope it's not. But don't let that to just get away from like what your genuinity and your caring and how much you just really give yourself to the patient, because this is so valuable. And sometimes we forget that, sometimes as we go, you're just start being new into this, you'll be graduating soon, and start a new adventure in this great career. And sometimes when we've been doing this for so long, we forget that and that touch. So it's important not to let that go away, no matter what come across you. So great for that. Um, was there anything about working with cancer patients that surprised you?
I think just how different it can be. We have a very regimented routine with a lot of these patients that we see. And even with that regimen, it is completely different, every single thing. I can have the same patient, same age, same type of cancer, same surgeon, same medication, same everything. And they present so different and they need different things. And that has been super surprising, where I was like, okay, there's a script to follow, but that script goes out the window very quickly, which has been both a challenge and a great learning opportunity. But that was definitely surprising, was how different the same thing can present.
Absolutely. And what do you think that is?
Oh man, if only I had the answers to that. But I think we are looking at these people as whole people, you know? I mean, we have patients driving an hour plus to come see us, and they have different supports at home, different genetic predispositions, different lifestyles, different external stresses. And so I think people are just completely different and they respond differently, whether they want to or not. And it's been a good wake up call to see that, and to not make assumptions based off of even, oh, I saw this yesterday. Let me assume it's not going to be the same as the person you saw yesterday.
Correct. But we know that the better prepared you are, the better outcomes you're going to have,
Absolutely.
right? So the healthier you are, the more you start to really do the homework and you start to look into, okay, if I just got diagnosed with breast cancer, for instance, or head and neck cancer, doesn't really matter. How can I prepare myself to try to mitigate as much of these side effects that is going to come to me? And the better prepared you are, the better you really put a lot of on the dots, like, okay, let's look and see how is my sleep. Let's look and see, what do I eat? What do I put in my mouth? What kind of exercise do I do? How do I manage stress? How much do I do self-care? Do I do any self-care to begin with? And the more patients out there, or the audience out there, if you have a loved one or you're just going through this, kind of start to really doing this, the outcomes are so much better than when they're not, and we see this day in, day out. Same thing if some patients decide to, I'm going to stop everything I'm doing. I'm just going to stop working because it's just too overwhelming. And sometimes that's not a good idea, because then every time that you feel anything, you're only going to think about what you're feeling, versus if you're busy and you try to carry on your normal life, then your brain is busy. You have work to do, or you have things that you need to be focusing on. So the other little things that happen, you're just going to ignore it because you're just going to move on, versus when you're not. So I usually try to tell patients, try to keep up the same routine as possible. If it's things that needs to be modified, or maybe drop some hours, or just organize or reorganize your time differently, because fatigue or because healing process or whatever goes on. But I think it's important to try to keep up the similar routine and actually improve your health. I would say 99.9% of the patients going through cancer only improve their general health. And unfortunately, it's sad for us to just be able to improve our health when we come across a disease, doesn't matter if it's cancer or not. But until that point, we never realize how much we don't take care of ourselves. And it should be the different, right? We should be more proactive and not reactive. We should be able to really start taking care of ourselves all along. So hopefully we don't have to face these diseases. And you can call it cancer, you can call it immune type of conditions, or whatever you want to call it. But I think that the more we really take care of our bodies from the beginning, the better off we're going to come across anything that happened to us. So we kind of get to see that often.
Absolutely.
What kind of interventions or modalities have you seen used to manage fatigue, neuropathy, or lymphedema?
I have had a great opportunity to learn a lot of manual skills. I didn't have a lot of prior experience in that in my other clinicals, so that's been amazing and really great to improve those skills. So manual skills, wrapping, I've been able to start doing a little bit, and then just, of course, exercise is such a big part of it too. But I definitely come from a more exercise heavy background, so being able to invest more in the manual side of things has been really, really cool to see, and see how many options you have in that realm.
Exactly. And it's not that many. I don't think it has been that new. I think that is more newer. I actually was just I'm reading about a research article. I'm excited to finish up, and I'll share it more on social media. But is about an osteopath and manual therapy in oncological patients, and how really people is like, oh, what does that mean? What is manual therapy means? How do we spend so many hands on patients? And we don't realize, you have a patient who had a diagnosis of cancer, anywhere, can be on the breast, can be on the head and neck, can be a sarcoma on the leg. You still be in your same orthopedic patient that you can do the same manual therapy, but you just add in the flavor of the cancer treatments, right? So all these other side effects that you need to be aware of that. But it's the same patient that you have to be more cautious about certain things, but people doesn't see it that way, right? For years, we thought the oncological patient was like, oh my God, we don't move, we don't do anything. You just sit on a chair and all the family take care of you and you there don't move. And we come across like absolutely not. We want to do the opposite, right? We wanted to get them working hard. We're doing high interval training program in our patients before they go into chemotherapy. So we do all these things. We see them through radiation and we work them hard throughout all that and that's how we see good outcomes, right? That's why they kind of get back into their prior function fairly quick. So I think it's really important for people out there to understand, manual therapy is not a contraindication in oncological cancer patients, because that's what we hear a lot in the school, right? Everything is a contraindication for cancer.
Yeah.
You don't do anything, so we won't be able to do anything with an oncological patient. So you really have to start looking in detail what exactly it is and what is not. So glad that you're able to learn that, and don't be afraid to touch a patient and perform your manual therapy skills on those patients. What has been the most rewarding patient interaction so far?
I think I have had a couple where either early in the session, the patient's a little bit having a difficult time, and we've had that conversation of like, just, it's not about you. It's not personal. They're going through a lot right now. They're doing whatever. And I think I have had the great experience of a patient comes in not doing their best, and I try to meet them where they are, and I'm not trying to kill them with positivity. I'm just where they are, getting them to feel better, letting them vent if they need to, and then I start to see the light come back a little bit. And then I had a patient who I hadn't seen in a couple weeks earlier this week. She was like a completely different person. She like stopped taking this medication that was giving her crazy side effects. And I saw her one day when she felt absolutely terrible. And then I saw her earlier this week and she's like, I haven't felt like myself in 4 years. And here she is. And she's like, I got down and I got to scrub my baseboards this week, which who would look forward to that? But if you haven't been able to for 4.5 years, so those have been really rewarding to like see patients who are not in a good place. And then whether it's throughout the treatment session or just throughout a couple weeks, like seeing them feel like themselves again is like such an honor and a privilege to get to see.
How has this internship shaped your view on what it means to be a physical therapist?
Oh my gosh, that is a loaded question.
Yeah.
I really think that this rotation has given me a lot more confidence in physical therapy and how we fit in like the greater care team, because all these patients, like I said, I've been saying a lot, your goals are our goals, and I think a lot of these patients are, especially oncology patients, are being told what they have to do. This is how you get rid of the tumor. This is how you get, this is how you increase your mortality, or like, they're trying to be cured of cancer, and being told what to do. They have no control in their lives. Everyone's telling them what to do. Well, you have to do this, you have to do that. If you don't, you're at a risk of this, a risk of that. Deal with the side effects, or else you're at an increased risk of that. And being able to speak with these patients and talk about the things that they can control and getting a little bit more power back to themselves. And it's been very empowering and very cool to see. And I think that has better informed my idea of what a physical therapist is, in terms of, yes, it's important that you take your medications. It's important that you're medically stable, that you can, make it another 6 months, 1 year. That's all important, but are you enjoying your time? Are you independent? Can you do all the things that you want to do? I think that a lot of people are not asked that on the day-to-day. And I think that's super, super important. So
Mhm.
it's been really cool to see how we can advocate for that as well within the greater care team. And it's super important, not just their medical status.
Correct. That's super. That's crucial. I think my motto is quality life over anything else, right? So I know it's scary. It's scary to have a cancer diagnosis. It's scary to go, not necessarily against what the physicians are recommending, but you know that is certain medications that you feel terrible on, and you're so afraid to stop them because your risk of recurrence, but at the same time you are trying to avoid recurrence, but you're living a terrible life because the day-to-day functionality is being so impaired due to these medications. So it is super important for patients to realize, let's look at quality of life and let's just come to like a mid agreement with your physician, right? Like don't be afraid to say, this is not working for me. What else can we do? And then try to use other alternatives that hopefully your physician should be able to give you. And then if none of that works, then you just have to again make a decision with the physician about quality life over risk of recurrence. And that's super important because like you just mentioned, we have a patient like that who she was not living until she just decided like, you know what, this is not working. She tried her best. They tried different medications and definitely the moment she stopped, it's like within 2 weeks, she's back to normal again. So it's important. Some patients will have no issues with it, which is great, but you gotta really look at the whole picture. What advice would you give other students considering a clinical internship in oncology PT?
Be open-minded and ask questions, which kind of go hand in hand, but you're not going to know everything. You're not going to know either the different protocols. Different surgeons have different protocols. Different institutions have different protocols. Understand where therapy is indicated versus not. Like these are all questions you're going to have to ask. Don't pretend like you know, because we are not taught this in school. And again, it varies between institutions and physicians and everything like that. So just be open to learning and asking questions and finding the nuance, because that's really at the end of the day, that's what this is. It's every patient is so nuanced. So just really, and also look things up. We had a question about a drug today and we Googled it, so always just constantly be ready to learn and ask questions for sure.
And what is one thing you wish more people understood about the role of physical therapy in cancer care?
Oh boy, I could get on my soapbox for this. It is, I mean, it's like a keystone in oncology care now in my eyes. We've seen patients who do receive physical therapy throughout their care and who do not, and the outcomes are very, very, very different. Not only for just objective range of motion and strength, but quality of life and function and everything like that. It has been so, it is very eye-opening to see just how big of a difference that we can make in oncology care, and we see it throughout the spectrum. We see it at diagnosis, pre-op, post-chemo, pre-op, or like post-op, radiation, seeing it through the entire journey. There's a difference that we can make at every single step. And I think that is something that is horribly neglected, just generally speaking.
Yeah, absolutely.
And that's what I did my paper on, or my journal club on, was like talking about exercise recommendations and how most facilities cancer patients just across the just in the country really are not receiving the care that they should. And PT is not contraindicated for oncology patients, how a lot of people think it is. So it's been very, very eye-opening to see just how big the differential is between where we are and the potential.
Yeah, and you're absolutely right. Is not that many people is like they come in is like, I'm here? Like, no, like I'm here just because the physician refer them. And we have the opportunity to work with a great breast surgeon that many times she's like, if you don't go to PT, I just won't do your surgery So we have the fortune to really work into a great interdisciplinary group that really push through that. And so sometimes the patients really come here like absolutely clueless because you're thinking, I'm going to go to PT because I have shoulder pain or I have neck pain. And many times these patients don't have any of it. And they're like, I have not even have surgery yet. I have no idea why I'm here. And when you start explaining how important it is to do baseline measures for future prospective surveillance program for lymphedema due to breast cancer and any other conditions, then they understand and how much education we can bring them that they will know what to do as a post-op. They will know if something goes this line after surgery, I know I can go this way, right? Or that way. So I think that really makes a big difference again in how they manage their own diagnosis. So is anything else you want to add for wrapping up, Maddie?
I have learned so much the last month and a half that I've been here, and it's been such a humbling experience to get to know all these patients. It makes me appreciate just exercise, health, and the human experience so much more. So I'm sad that it'll only be a couple weeks left, but I've had a fantastic time.
Well, we have a fantastic time as well having you, Maddie, and thank you again for being here with me. Thank you for really being passionate about these patients. I always say my goal in life is to convert every one of my students in oncology therapists, and I hope I'm continue taking you onto that road because it's a lot of need for us, and it's a lot of great things we can do just through the whole country and world in this aspect of this aspect of a specialty in oncology in physical therapy like oncology is. So I really appreciate all your hard work and thank you again for being part of the show.
Of course, thank you.
Oh, how can people contact you? And I know I have this
yes.
in the show notes.
Okay. My best is probably email madeline.mccain@gmail.com.
Okay, perfect. And like I said, I'll put that on the show
Yeah,
notes as well.
perfect.
Well, thank you again for everybody to taking the time to listen to another great podcast episode and see you later.